This is Selma Schimmel at the San Antonio Breast Cancer Symposium, joined now by Dr. May-Lin Tao, Co-Medical Director of the Center for Radiation Therapy of Beverly Hills, an affiliate of Valley Radiotherapy Associates and Vantage Oncology. Welcome.
Thank you.
Dr. Tao, maybe we can take a few minutes to sort of address the mammogram controversy and the mammogram confusion.
Mm-hmm.
Women are reading stories that there have been more than 1 million women overdiagnosed from screening with mammograms. Now there are 3D mammograms, and women don't know, should I have a digital mammogram? Should I have a 3D mammogram? Maybe I can have an MRI. Could you maybe clarify or shed some light on to help women understand the benefits, the risks, and the technology, where we're going, and what might be best for them?
This has been a very hyped issue now for a few years at least. I think what we're learning is that even though the older studies, and there were a number of them, showed that there is a benefit for large-scale screening mammography in terms of saving lives. But as we're also moving forward, we're also learning the trade-offs in that process, which is that there are, in addition to that benefit, some women who are going to get diagnosed with cancers or diseases that really are not what we call clinically significant, meaning that it will lead to a procedure, it will lead to anxiety, it may even lead to a diagnosis of cancer. But in fact, if it had never been detected, they never would have felt any different for it. So that's the problem with any technology, is that it's not perfect, and there are some trade-offs anytime we get a procedure done. So I think what is happening is that now women themselves are learning about this more and more. They're getting the education. It's in the popular press in very dramatic ways. This paper was highlighted very dramatically in the press, as were the preceding arguments about when the U.S. Prevention Task Force came out and said we should be doing less screening. There are now at least 3 different guidelines about breast cancer screening. It ends up being really a discussion between the primary care doctor and the patient, preferably before they actually end up in the mammography unit, about the value for them. And probably for the average American woman, we should stick with what have been our standard guidelines for years. And what we should start thinking about is for the women that really wouldn't benefit from something like this because they really have other competing risks. So the much older woman, or the woman who has lots of comorbidities and other reasons that could be compromising her health. Does she need to be getting a mammogram when she doesn't have a very strong family history or propensity otherwise for developing a breast cancer that may lead to other procedures?
What about the evolving technology with 3D imaging?
That, like MRI, although there's more evidence of this for MRI, is purported now to be a more precise tool to be able to look at women's breasts.
Does 3D mammography still compress the breast?
It's a similar tool. It's basically the same device. You're getting multiple images from different angles so that the breast can be reconstructed 3-dimensionally, and the radiologist is able to basically look through the breast from different angles, and hence the issues of density become less problematic. So what was seen initially as overlay on a 2-dimensional image, you can look from a different angle and see things with greater clarity. And so hopefully you'll have fewer false negatives, and you'll be able to better sort out things that seem positive. And in fact, when you look at it from different angles and turn the volume of the breast while you examine it, it actually turns out to be just overlying dense breast tissue. So that's the theory behind it, and it's FDA approved, which is an easy thing to do for a new device, but there's really no evidence yet to say that in fact it does all those things. And the downside is it does expose a woman to more low-dose radiation, and if this is a regular event, over many years, then that could actually be more of a detriment than a benefit if there really isn't a benefit, or your risk is very, very low.
Thank you so much for giving us this perspective and highlighting the advances in the area of radiation oncology. Dr. May-Lin Tao, a co-medical director of the Center for Radiation Therapy at Beverly Hills, an affiliate of Valley Radiotherapy Associates and Vantage Oncology.
Thank you.